Hi, my name is Ken Fickler. I'm the founder and CEO of Gaze, and today I want to talk about why impairment detection should be a focus for workplace safety. Now, in today's rapidly evolving drug scene, ensuring workplace safety is a paramount concern for employers. Traditional drug testing has long been a cornerstone of workplace safety protocols. It aims to prevent accidents and injuries by detecting substance use amongst employees. However, the limitations of this approach have been increasingly evident, particularly with the changing legal landscape surrounding cannabis and the emergence of hundreds of new substances. Impairment detection technology has risen rapidly as a more effective and immediate solution to maintaining a safe and productive work environment. For decades, workplace drug testing has relied heavily on urine, oral fluid, or saliva, and hair samples to detect the presence of substances such as marijuana, cocaine, opiates, PCP, and other controlled substances. The primary goal was to deter employees from using drugs and identify those who had, thereby reducing the risk of impairment-related accidents. However, this traditional approach has had several inherent shortcomings. The first is time lag. Most drug tests take hours to receive preliminary results and up to a week or more, potentially, to receive lab-confirmed results. This is far too long for a business to make use of the results in any sort of real-time fashion. There aren't many businesses who can afford to have critical employees sitting on the sidelines while they wait for drug testing results. Next up, legal cannabis. With the legalization of cannabis in many states and countries, employees may legally use cannabis outside of work hours. However, traditional drug tests can still detect THC, which is the psychoactive component of cannabis, for long after its impairment. However, traditional drug tests can still detect THC, which is the psychoactive component of cannabis, long after its impairing effects have worn off. This leads to potential legal and ethical issues, not to mention difficulties in hiring. If you're only detecting past use of cannabis and not current impairment, you're going to detect people who are safely and responsibly using cannabis in their off time. Next is the variety of substances available. There's an ever-growing list of new psychoactive substances and prescription medications that makes it impossible for traditional chemical tests to keep up. Very few substances are detectable through these standard drug tests, leaving very dangerous gaps in safety protocols. Now, fentanyl is a great example. It's my favorite example because it's not included on most standard drug panels. It's an exceptionally dangerous drug that is incredibly addictive and causing massive fatalities across the world. It's not included on the chemical drug tests that most companies are doing today, and that's crazy. Last is cheating. Most chemical drug tests have easy to find and effective methods to cheat on the results. As an example, fake urine and shampoo designed to strip the chemical markers of drugs from hair are readily available and reasonably effective. And in fact, Quest Labs recently released a report in 2024 saying that they found a 633% increase in the use of certain methods to try to defeat drug tests. That's a shocking increase. So given these limitations in traditional chemical drug testing, there is a pressing need to be more accurate and immediate in assessing an employee's ability to perform their duties safely. But how, for an example, does an employer in a cannabis legal state verify that an employee's positive THC test was due to use during work hours rather than safe and responsible use in their free time? This is where impairment detection technology comes into the picture. Impairment detection technology focuses on evaluating an individual's current cognitive and motor functions rather than looking for specific chemicals in their body. This approach measures actual impairment, ensuring that employees are fit for duty at the moment when they start their work. And depending on the technology, it can either be entirely generalized, that is, no indication of the cause of the impairment, or, as is the case with Gaze, which is our technology, it can actually help you determine the cause of the impairment. There's some real benefits that come into play with impairment detection technology, and the first is real-time assessment. Unlike traditional chemical drug tests, impairment detection technology provides immediate feedback on an employee's current state. Now, this allows employers to make timely decisions about an employee's fitness for duty. Most tests take just a few minutes to complete, and in the case of Gaze, results are available in 6 minutes after the test is started. Next is a focus on actual safety. And by assessing impairment directly, employers can better assure that employees are fit for duty and capable of performing their tasks safely, which reduces the risk of accidents and injuries. With increasing drug test positivity rates, Impairment detection technology can also bring a deterrent effect back into a drug-free workplace policy. Employees will now know that they can't show up to work high and expect to get away with it. Now, next is privacy and fairness. Impairment detection respects employees' privacy by not capturing bodily fluids or intruding into their off-duty activities. It focuses solely on their ability to perform their job safely at the time of assessment. Further, for safe and legal cannabis users, impairment detection technology is radically more fair than any chemical test because it actually looks for current impairment rather than prior use. And that's why many employers are adopting it today. Now, next is comprehensive coverage. This technology can detect impairment from a broad variety of sources, allowing employers to make better decisions in the moment than would be possible using chemical tests. With an average of 2 new drugs being introduced to the market every week, it's impossible for any chemical test to keep pace. Even some of the most common drugs of abuse, like fentanyl, delta-8 THC, and kratom, are not included in standard drug tests, and this leaves employers totally exposed to the negative and impairing effects from these substances. Now, adopting impairment detection technology is not typically overly complex or time-consuming. It involves a review of the existing drug-free workplace policy and the addition of simple language to allow for impairment screening. Now, some of the leading methods for impairment detection include cognitive testing, and these tests evaluate things like reaction time, memory, attention, and other cognitive functions to assess impairment. Now, next up is motor skills assessment, and these are tools that measure things like coordination, balance, and other motor skills to identify impairment that may not be readily impairment through cognitive testing alone. And last up is wearable technology like smart glasses or wristbands that can continuously monitor an employee's physical or cognitive state and provide real-time data that could potentially help you evaluate impairment. Now, I want to speak specifically to Gaze because we think this is the best impairment detection technology that exists. It's very quick and easy to use, and most of our customers have accomplished integration in less than a week. We provide sample policy language, legal support via our legal partners, and technical support to ensure that the system functions flawlessly within a customer's facility immediately. You can touch base on any questions related to deployment. We're happy to answer them. But in summary, the evolving landscape of substance use and the increasing complexity of modern workplaces necessitates a shift from traditional chemical drug testing to impairment detection technology. By focusing on real-time assessment of an employee's fitness for duty, employers can enhance workplace safety, ensure fairness, and adapt to changing legal and societal environments. At Gaze, we're at the forefront of this transformation, providing an innovative solution that prioritizes safety and performance in the workplace while ensuring fairness as well. Embracing impairment detection is not just a step forward, it's a leap towards a safer and more fair future for everyone. Thanks so much for the time today. Please get in touch if you have any questions.